I know. How you doing? You look great.
You still got your purple hair.
I know.
And I don't got none.
You look great, though. It looks adorable on you.
Thank you.
Sean Cartwright spends a lot of time working with the homeless community in San Jose.
I just wanted to come out and find out, like, are you finding out anything about coronavirus or the city and county coming out and telling you anything?
I think they rely on the television and radios, but a lot of us don't have televisions and radios because we don't have power.
The big thing on her mind these days is the coronavirus. Are the homeless at more risk for diseases like this?
They are, because the 4 things that they mention on the CDC site that make you more at risk: over 50, and any heart, lung, or kidney disease. And that is like the vast majority of unhoused people. So for them to even notice, like, wait, I might have a fever or my cough might be worse than usual, by the time that they decide that, hey, I think I'm actually really sick, there's probably a whole bunch of other people that already have it by now, or that they've given it to. And then what happens is, okay, so you're unhoused. You go to the hospital, you don't feel good. And then they can say, okay, you've got it. And now we're gonna quarantine you. Where?
The CDC recommends that people use hand sanitizer and wash their hands regularly. But for the homeless who don't have access to those expensive supplies, or even running water, that can be nearly impossible. Valerie Kirkland has been living in a tent along a street named after the co-founder of Apple, Steve Wozniak. What are you doing to be careful?
Those wifey things, and then I have a stove, thank God.
You can actually heat up some water and then use that to wash your hands. Because you don't have running water, obviously.
And to wash my little dishes,
So how worried would you say you are?
You know what? When God wants me, He's going to get me.
Public health experts worry about the homeless because sicknesses that affect them don't just stay in that community. And the same goes for many of the working poor, groups that have traditionally been underserved by the social services safety net. That could pose a significant challenge to any large-scale efforts to keep the public safe in an outbreak. Anne Mongavin is a public health expert at Santa Clara University.
I think this epidemic is shattering our illusion that social justice issues that affect the most vulnerable don't really affect those of us who are more fortunate. So we want people who are sick to stay home. But the homeless have no home, and low-wage workers may be less able to take time off for work. And we want really sick people to get care as soon as possible. And these populations tend to put that off for various reasons. The cost of health care for the undocumented, the fear that it could reveal undocumented status. There are whole populations that are not going to be coming forward and saying, maybe we should be tested.
How much does having these large underserved populations impede our government, our state government's ability to keep this virus in check?
I think we're going to find out, but it certainly poses a very big danger. And it's another way I would say that radical inequalities in our society are intrinsically a public health threat.